Hello students. Today, we will be diving deep into the fascinating world of histology, specifically focusing on the intricate subject of articular cartilage and its various aspects. Articular cartilage plays a vital role in maintaining joint function and enabling smooth movement within our bodies. In this lecture, we will explore the molecular mechanisms underlying articular cartilage degeneration, the components of synovium and synovial fluid, the role of immune cells in the pathogenesis of rheumatoid arthritis, and much more. So, let's embark on this journey together and unravel the intricacies of articular cartilage histology. Articular cartilage degeneration involves various factors such as oxidative and mechanical stress, as well as inflammatory mediators. Pro-inflammatory cytokines IL-1 and TNF-alpha activate signaling pathways like NF-kappa B, leading to increased MMPs and aggregonases, which degrade cartilage components. Identifying these mechanisms can aid in developing treatments for cartilage degeneration. In the video, we discuss the synovium, a specialized tissue that lines joint capsules. It consists of two layers, the intima and subintima. The intima is made up of synovial cells like fibroblasts like synoviocytes and immune cells. These cells play a role in secreting important components of synovial fluid, which lubricates joints, provides nutrition to cartilage, and aids in repair. Dysfunction of synovial fluid production can cause joint problems and cartilage degeneration. Rheumatoid arthritis is caused by immune cells attacking the synovium, leading to joint deformities. Autoantibodies like rheumatoid factor and anticyclic citrullinated peptide antibodies exacerbate inflammation. This prompts the release of pro-inflammatory molecules and the invasion of immune cells, eroding articular cartilage. Targeted therapies rely on understanding these dynamics. Articular cartilage consists of chondrocytes in a collagen-rich extracellular matrix, ECM, containing proteoglycans and non-collagenous proteins. Collagen type II provides strength, while proteoglycans like aggrecan enable compression resistance. This ECM structure enables low friction, high load-bearing capacity, and shock absorption in articular cartilage, facilitated by chondrocyte ECM interactions and sensing of mechanical stimuli for maintaining cartilage homeostasis. In this section, we will explore the important role of joint lubrication in maintaining healthy joints. Synovial fluid, produced by the synovial membrane, acts as a lubricant between joint surfaces. Proteins like lubricin help reduce friction and protect cartilage. Understanding these mechanisms can aid in developing treatments for joint health. The development and repair of articular cartilage are regulated by intricate molecular signaling pathways. One such pathway is the transforming growth factor beta, TGF-beta, pathway, which plays a crucial role in chondrogenesis. TGF-beta stimulates the synthesis of ECM components, including collagens and proteoglycans, promoting cartilage formation and repair. The bone morphogenetic protein, BMP, pathway is also involved in cartilage development and plays a significant role in regulating chondrocyte proliferation and differentiation. Activation of these signaling pathways is necessary for maintaining cartilage integrity and promoting its repair in case of injury or degeneration. Articular cartilage injuries and degenerative conditions are difficult to treat due to limited natural healing. Tissue engineering and regenerative medicine offer solutions. Scaffold-based cartilage engineering and cell-based therapies show promise by mimicking the natural environment and promoting regeneration. These approaches can improve joint function and treat cartilage defects. Osteoarthritis, OA, is the most common degenerative joint disease characterized by the progressive erosion of articular cartilage. It is influenced by various factors, including aging, genetics, and biomechanical abnormalities. OA is associated with the loss of proteoglycans, collagen degradation, and alterations in chondrocyte function. Chronic inflammation, joint instability, and cartilage wear and tear contribute to the disease progression. The understanding of OA pathogenesis is crucial for the development of novel therapeutic approaches aimed at slowing down disease progression and preserving cartilage integrity. The biomechanics of load-bearing joints, such as the knee and hip, are crucial for understanding joint function and degeneration. These joints experience significant forces during movement and require a delicate balance of stability and mobility. The distribution of load and stress within the articular surfaces, menisci, ligaments, and other joint structures play a crucial role in joint integrity. Abnormal biomechanical forces, such as excessive loading or abnormal joint alignment, can alter the mechanical environment and lead to articular cartilage degeneration. By studying load-bearing joint biomechanics, we can gain insights to develop preventative strategies and better manage joint disorders. Accurate assessment of joint integrity and cartilage quality is vital for diagnosing and monitoring various joint diseases. Imaging techniques play a crucial role in this regard. Magnetic resonance imaging, MRI, for instance, provides detailed information about cartilage morphology, thickness, and integrity. Complementary techniques like computed tomography, CT, and ultrasound, US, contribute to a comprehensive evaluation of joint health. Advanced imaging techniques, including biochemical imaging and molecular imaging, offer exciting prospects for the non-invasive evaluation of articular cartilage. Continued advancements in imaging technologies will undoubtedly enhance our ability to detect and monitor joint diseases. In this section, we will explore the mechanics of articular cartilage. We will discuss how its unique properties and composition allow it to distribute loads, absorb shock, and withstand repetitive forces. We will also investigate the role of collagen fibers, proteoglycans, water, and chondrocyte microarchitecture in determining its mechanical behavior. Understanding these aspects will help us maintain joint health and develop treatments for cartilage damage. Comparative anatomy and the study of joints in various species enable us to gain a broader perspective on joint structure and function. Different species exhibit variations in joint morphology and biomechanics to adapt to their specific locomotor needs. For example, in weight-bearing large mammals like elephants and giraffes, their joints have evolved to withstand substantial forces. The study of comparative joint anatomy helps us identify shared features, evolutionary trends, and potential adaptations to different environmental and mechanical demands. These insights can contribute to the development of innovative solutions for joint-related disorders in humans. By examining the histology of articular cartilage, we gain valuable knowledge about joint health and disorders. Understanding the molecular mechanisms, involvement of the synovium, the role of immune cells in rheumatoid arthritis, and cartilage composition allows us to improve diagnosis, treatment, and regenerative approaches. Let's continue to explore and be amazed by the wonders of histology.